The latest news, updates, and more from the world of health and medicine. This is Medical Minutes with Wish TV's medical reporter, Dr. Mary Gillis.
From Wish TV, I'm medical reporter Dr. Mary Gillis, and this is Medical Minutes on the All Indiana Podcast Network. Omicron has taken root in the U.S. Hospital admissions are on the rise across the country, with nearly all beds taken up by the unvaccinated. In this episode, I speak with Dr. Paul Burton, Chief Medical Officer at Moderna, about the future of the pandemic. We also discuss the one-year anniversary since government regulators gave emergency approval to the Moderna vaccine, as well as tips to prevent COVID-19 infection this holiday season. Our conversation is next.
Hello, Mary.
Hi, Dr. Burton. Great to meet you.
Hey, great to meet you too, Mary.
Thanks for your time and appreciate the opportunity. Let's jump right into it. So let's kick it off. Your top 4 tips for people during this gathering, during this holiday season. What is your message to them?
So, Mary, look, I think we're right in the middle of this pandemic. We're right in the middle of Omicron. I would say there are some simple things that we can all do. Just don't forget them. One is, keep hand sanitization going, wear a mask, keep some social distancing. It's hard during the holidays, but it's simple and it's highly effective. The other big thing is, if you haven't been vaccinated, now is the time. I know that in your region, about 55% of people have had at least one vaccine, which is great, but that number can even come up further. So if you're on the fence, get vaccinated. And if you've been vaccinated, now is the time more than ever to go and get boosted. So those are my top tips, Mary.
Okay. Are we talking about even when families, friends are vaccinated and perhaps even have their booster shots when they're coming together? Do we still need those masks? Do we still need that social distancing? Can we hug people?
So it's a good question. Look, I think, Omicron is a highly, highly transmissible variant, and it's also a severe variant. This is not, I don't think the data suggests it's not a mild variant. So I would take those extra precautions, and I think you have to use your good judgment around hugging, but just be cautious. This is not a time to let our guard down.
Yeah, air hug. That'll have to do for now.
Okay.
So while I want Omicron, so I want to follow up on that. So it is more contagious, yes. What makes you say it could be more severe? And then, right, it's landed in the States, but it really hasn't caused any death, I want to say, cross our fingers. Are we overreacting to this variant, or is it really time to buckle down?
Yeah, so look, I think, Mary, you're right. We have not seen the death rate that we saw in earlier phases of the pandemic and with Delta, for example. But let me give you some data from Denmark. The hospitalization rate for Delta in Denmark is about 0.7%. It's still early days, but the hospitalization rate for Omicron in Denmark is 0.8%. So it's right in the same ballpark. Today in South Africa, there's about 7,500 people in hospital, almost certainly with Omicron as their major cause of COVID. The 7,500 of them, about 15% are either in high dependency or ICU. So I think while we haven't seen the death rates, as you say, and that's a fantastic thing, in terms of hospitalization, this remains a severe and serious variant, and we need to take it very seriously.
Okay, right. Hospitalizations, we definitely don't want those. And then this Omicron seems to be sort of more breakthrough cases. I mean, maybe we don't have sort of statistics, but anecdotally, we're seeing someone gets a breakthrough case. And I'm sorry, that's not what I wanted to ask you. That was my apologies. I wanted to talk to you about yesterday's announcement that Moderna and Pfizer are preferential over J&J. So what does this say about the Moderna vaccine, the mRNA approach technology compared to the adenovector approach?
Well, Mary, look, I would say, we're fortunate that we have 3 highly, highly effective vaccines. When you go back to the start of the pandemic, we had nothing, and we would all have been very happy with vaccines that have 50% efficacy, and we ended up with 3 excellent ones. So I think what we need to do as manufacturers right now is give that clear, simple message to the world that we have great vaccines across the board, and people should use them, get vaccinated, and get boosted.
Okay, well, Dr. Burton, and then your latest updates. What's going on with Moderna right now?
So look, boosting is important. We have 2 types, the 50 microgram boost that most people get, the 100 microgram boost, the enhanced boost. that you can get if you're immunocompromised, cancer, for example, so you can tailor the boost as needed. And so we're doing that. A great website called makeityourvaccine.com provides excellent information, let you know where boosts are available. And of course, Mary, we announced back in Thanksgiving that we're working on a Omicron-specific vaccine. That work continues. We're leaders in this field. It's on us to help keep everybody protected and to keep driving forward with new and effective vaccines for COVID. So we're committed to doing our part to absolutely end this pandemic.
Well, right. I mean, it's great to be prepared. We don't know exactly just yet. So, but the Omicron specifically, we know it has sort of over 50 mutations of different viruses, but most of them are things that have fizzled out. I mean, Lambda, the Beta, the Alpha. I mean, I don't know if there's any sort of lineage of Delta in the Omicron. So I'm just wondering why be preparing just now when we don't know yet. I mean, it's always good to be prepared, but just...
Yes, absolutely. So look, Omicron has, as you say, 51 mutations. It shares those across Alpha, Beta, Gamma, and Delta. And 30 of the mutations are in the spike protein, which is the bit of the virus that the current vaccines really go after and recognize, and where the antibodies are made against. So that's why it's so critical, and that's why we've seen some waning of immunity up against Omicron. With boosting, we can still get antibody levels up and we can protect people. But next year, as Omicron really becomes perhaps a dominant virus here and around the world, I think we need to be prepared with an effective and specific vaccine for it.
Well, Dr. Burton, one doctor once told me when we look to the UK, they're about 2 months ahead of us, and that there's been this pattern where it's sort of a little bit of a prophetic in terms of what's going to come our way. So I think it's great that you and your company are doing that and being prepared. In 30 mutations on the spike protein, that's quite a number. Last question for you. President Biden said in an interview, we are in for a very dire winter. I mean, sort of many fatalities. We could see up to 15,000 deaths per week over the next couple of weeks. What are your thoughts on that?
I think the issue, Mary, with Omicron is its transmissibility. Right now, we aren't seeing the death rate that, as I say, we've seen in the past, but we're seeing hospitalizations. And I think the problem is going to be that as many people do get infected, it's the winter, people are indoors, the different demographic here compared to South Africa, people have different comorbidities, hospitalizations will occur and they'll begin to stretch an already burdened system. I think that's the issue, and that's why we have to be so vigilant and so careful now. Take those precautions and get boosted. And, as always, just a huge shout out to those frontline workers. They've been protecting us for the last 2 years. They're doing it now. We're getting vaccinated. Just a huge shout out to all of them for everything they're doing.
Well, it's so interesting that you said in terms of different countries, because we see studies of natural immunity that are 7 times more effective in certain countries. And then there's studies that say the vaccine is X amount of times more effective than natural immunity. You cannot compare 2 countries, right? The United States has 70% of people who are obese, and with it comes comorbidities. So it is not apples to apples. It's apples to oranges, apples to bananas to melons. I don't know. But I love that was a great, thank you for saying that. And then anything else you'd like to add? I'm sorry I'm talking so fast. It's just really great to meet you.
No.
And I'm so happy for the work.
You've
been so great. I want to say thank you for all the work that you've done for our country. But anything else?
Thank you. No, listen. Yeah, the only other thing I would say is, Saturday marks the 1-year anniversary of the authorization of the Moderna vaccine. And these vaccines, as I say, as a group, have just been remarkable. 1 million lives saved, 10 million hospitalizations saved, 370 million doses of the Moderna vaccine given around the world now. It's very safe and it's highly effective. So, there's never been a better time. The best gift, honestly, you can give to your family, your loved ones, to yourself this holiday season. Get vaccinated, get boosted, and take care.
This has been Medical Minutes from Wish TV. I'm medical reporter Dr. Mary Gillis. Be sure to follow and subscribe to this podcast and check out new updates every week. You can also learn more at wishtv.com and when you follow Wish TV on Facebook.
Learn more and get more with Wish TV. Online at wishtv.com and when you follow Wish TV on Facebook. Be sure to check out more great podcasts from the All Indiana Podcast Network now at allindianapodcastnetwork.com.